Okay, hi, sir. I'll be your doctor today. What brought you into the emergency room?
Oh, my chest is killing me.
Okay, you're having some chest pain. Nurse, could we put in 2 IVs and just grab a rainbow of labs? I'll let you know what I want in a little bit.
Okay.
If you could get them on the monitor and get a full set of vitals, including a temperature.
Okay.
And then I'm going to continue getting a history. Okay. Sir, when did your chest start hurting?
About 20 minutes ago.
20 minutes ago? Okay. Have you ever had chest pain before?
A little bit. It's kind of had this on and off the past couple days.
Okay.
Nothing like this.
What makes the chest pain worse?
When I move.
When you move? Okay. And is it staying right there or does it radiate anywhere?
I kind of feel it going up into my jaw.
Okay. Okay. Anything with it, like shortness of breath?
Yeah, I can't really breathe and I feel nauseous.
Okay. Can we get, just put him on some nasal cannula, 4 liters?
4 liters.
Yeah. Do you have medical problems, sir?
Just high blood pressure.
High blood pressure? Okay. And then have you ever had any surgeries?
No.
No? Okay. How about, do you have a family history of heart disease? Like anyone died young?
Oh, I don't know. I'm adopted.
You're adopted. Okay. And then are you a smoker?
Yeah, I smoke a pack a day.
Pack a day. Okay. Any allergies to medications?
Oh, no.
No. Okay. Can we get an EKG, a 12-lead EKG on him?
Sure.
And then with the blood work that you drew, if you could send a troponin, a BMP, a CBC, coags, and a pro-BNP.
Okay.
And then if we could also get a chest x-ray as well.
Okay.
Okay, sir. Have you tried anything to make the pain better?
No, just resting.
I'm just going to examine you here. When I look at the patient, do I see anything just abnormal on his general exam?
You see moderate distress from pain and slight diaphoresis.
Okay. Now I'm going to listen to his heart and lungs. What do I hear?
His heart has a regular rate and rhythm, no murmurs, and his lungs are clear to auscultation bilaterally.
Okay. Do I notice any JVD?
No jugular venous distension.
Okay. And I'm feeling both radial pulses. Do I feel good pulses?
Good pulses and
Okay. And I'm feeling his belly. Any pain where I'm pressing or masses?
Non-tender, non-distended, no hepatosplenomegaly.
Okay. And then in terms of his lower extremity exam, any swelling?
No swelling.
Okay. And are the extremities warm or cold to touch?
Warm.
Okay. All right. Do I have that EKG yet?
back.
Okay, perfect. All right. So I'm looking here at the EKG. Does look like there's some pretty peaked T waves in V2 through about V4. I do see some mild depressions in V4 through V6 and also in the inferior leads. So let's keep the EKG leads on here and get a repeat soon.
Okay.
I'd like to give him 324 of aspirin right now.
Okay.
And we can also start with a sublingual nitroglycerin
Sublingual.
to try to improve his pain. All right, so we're going to give you some medications here to try and help with your pain.
Uh,
How are you feeling?
I'm not feeling so good, Doc. I'm starting to feel really dizzy.
You are? Okay. So we have the oxygen on. He got his medications. We'll get a repeat EKG here soon.
All right. Chest x-ray came back.
Okay, perfect. All right, I'm taking a look at the chest x-ray here. I don't really see anything too abnormal. The trachea is midline. I don't see any abnormalities of the bones. Costophrenic angles are sharp. No obvious pneumothorax or opacities here. All right. So, sir, how are you feeling after receiving that nitroglycerin?
Feeling a little better.
Okay. Are you still having the pain?
Yeah, it's still there.
It's still there. Okay. Do we have our lab work yet?
Yes, I can get that.
Okay. Looking here at the labs. Okay.
Starting not to feel so good, Doc. Starting
Okay.
to feel dizzy.
Oh, really? Okay. Can we rerun his blood pressure?
Sure.
And yep. Okay. So I'm looking here at the monitor. Oh no. Okay. So his heart rate's pretty high. It looks wide. Looks like his blood pressure is 83/44. Okay. So this appears to be VTAC and it's unstable. I don't think I'm gonna wait for a 12 lead EKG. His blood pressure is pretty low. Can we get the pads on him?
Yes.
Okay, great. And then, sir, we're gonna have to do something called a shock to get your heart into a better rhythm, okay? This might hurt a little bit, but I'll give you some pain medication.
Okay.
Can we draw up 100 micrograms of fentanyl?
Fentanyl.
Perfect.
Okay.
And then I'll come over here and run the monitor with you. Okay, so the patient is in unstable VTAC. So I know he needs cardioversion. In order to do this, I'm gonna turn my machine to defib. Cardioversion means that we're synchronized. So I know I need to press sync down here. I know that I'm synchronized because there are these tick marks after each QRS complex. I'll choose my energy. I know it can be between 50 and 100 joules. I'll start with 100 because he's pretty large. And here I'm going to charge. Wait for my light to come next to the shock. Okay, sir, we're gonna give you a shock now, okay? Everyone clear? Okay, great. Can we recycle the blood pressure? And it does look like he's now back in sinus rhythm. The rate is in the 80s to 90s. And can we get a repeat 12 lead EKG? Sure. All right, so where's the EKG? Here it is. Yep. Okay. All right, so I'm seeing ST elevation in the lateral leads here. I'd like to call a code STEMI, activate the cath lab. And let's get this patient to the cath lab as soon as possible.
Sounds good, doctor.